You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Fred Pescatore, MD. Dr. Pescatore is the medical director of Partners in Integrative Medicine in New York City. He is the author of the New York Times bestseller, The Hamptons Diet, his fourth health and nutrition book. He is here today to discuss how food sensitivities can make you fat. Dr. Pescatore, welcome to the program.
Thank you very much.
Now, before we get into today's topic, a little bit about your background. Now, you ran the Atkins Center, very well-known center, for 5 years.
Yeah, I was the medical director there for about 5 years in the 90s. So this was before low-carb craze really took off.
Now, your practice today, much different than what you were doing back then, the Atkins Center?
Well, the practice, sure. I mean, medicine evolves, science evolves, so my practice is now exactly everything it should be. I mean,
okay.
it's the latest, up-to-date, most newest information you could possibly imagine.
Okay. I read your book over the weekend, The Hamptons Diet. It is much different than the Atkins Diet. How is it different, by the way? And how does it tie into what we're talking about today, food sensitivities?
Well, those are two separate questions,
okay.
Two separate issues. I mean, the Hamptons diet is different from the Atkins diet. For main reason is you don't have to get into ketosis. There's no gimmicks.
Okay.
So there's not that. I also separate out the fats. I think there are some healthy fats, and I think there are some really unhealthy fats.
Okay.
Atkins diet never took that into consideration. I believe that you can have healthy whole grain carbohydrates, you can have fruits, you can have vegetables, you can do all of that, and you can do all of that from the very beginning of a diet. So the Hamptons diet really, I think, is just, again, the most cutting-edge technology and the most cutting-edge science to date.
Okay.
Because diet books always have to evolve, because we learn new things all the time.
Now, nutritionists of the stars, they're calling you. Names like Sarah Jessica Parker, Kate Hudson, Matt LeBlanc go to you for advice. Is that right?
One can say that, sure.
Okay, okay. Now, how did you get this celebrity following, by the way?
Well, I think a lot of it has to do with just being in New York,
Okay.
naming the book The Hamptons Diet, a lot of celebrities out there. And I just think because it's an easy plan to follow. It's an easy plan to follow, it works, it's customized, it's personalized, it works specifically for them. And you can eat. So it's not a diet program where you have to give food.
So you walk your talk. I mean, you look healthy.
Absolutely. I mean, if I don't do it, how can I expect other people to do it?
Now, one of the reasons we invited you on the program today is to talk about food sensitivities. One of the books, Your Hidden Food Allergies Can Make You Fat. You said on the telephone that 90% of your patients have an ALCAT test. I guess it's a food allergy test or a food sensitivity test?
Well, it's a food sensitivity test. I mean, right from the beginning, we have to be very clear about this. I mean, allergies, food allergies, and food sensitivities are two completely different things.
Okay.
One, food allergies, you generally know about because your throat will close up, you'll get hives, you'll have all sorts of bad things happen to you. You can die from a food allergy. Those are things like peanuts and wheat and soy and eggs.
So immediate response type
Absolutely.
reaction. Okay.
Now, food sensitivities, on the other hand, which is something the ALCAT test measures, measures things that are a little more subtle, things that you may never realize is bothering your body.
Okay.
So what you have then is you could have up to a 72-hour reaction. Or you can eat a particular food and not know for 72 hours that was the food that was affecting you.
Okay, give me an example. So for example, when it says food allergies or sensitivities can make you fat, give me that example where it's a hidden food allergy that you don't even know about. Or sensitivity.
Most people will not know what their food sensitivities are.
Okay.
I mean, it could be the things you're eating every single solitary day. That could be the one thing that's preventing you from actually getting to your goal weight. A lot of people, weight loss is a process, right? So a lot of people they'll lose 20 pounds, 30 pounds, 40 pounds, and they reach that plateau that everybody hates to reach. And that's where things like an ALCAT test comes really in handy, because then you can really know what your body likes, what your body doesn't like. Because when you're measuring these sensitivities, you're measuring something that's causing your body to be inflamed. And when your body's inflamed, it can't function properly. Your metabolism can't function properly. Your digestive system can't function properly. Your body can't metabolize the food and nutrients properly. So that's why it's so important that we have tests like the ALCAT test to help us.
So when patients go to you, let's say for weight loss, or they just want to feel better, how are you using the ALCAT? I mean, what does it help you do?
What it really helps me do, the ALCAT test really helps me customize a program. So if you came into my office, you'd walk out with a different program than if the producer came into my office and needed to lose weight or to get healthy or to feel better about themselves. So so the ALCAT test helps me personalize it, customize it, so that, because each person's different. You'll never know what you're going to get from this test. And oftentimes people are surprised. They can't believe that something as simple as chicken, let's say, or salmon or wheat is bothering them. Then they get rid of it and they're astonished. They say, wow, I feel so much better now. My headaches are gone. I'm able to lose that weight. I don't get gastric reflux anymore. I don't get heartburn. None of that stuff. It goes away.
Sounds like an overstatement. That's not an exaggeration. You see that every week?
I see that every day. So it does sound like an overstatement.
So do you have patients that go to you, and maybe they want to lose that last 20 pounds, maybe for a movie or whatever? They do an ALCAT test. Something comes up.
Well, 20 pounds. They're not going to lose 20 pounds for a movie. Most of them are going to only have 5 or 10 pounds.
5 or 10 pounds, but they can't do it.
Right.
Does it come up where something pops up, a particular food? You eliminate that food. If I understand it correctly, the way this works, you do a test, they show a food allergy, say to salmon, and they're eating it all the time. They remove that salmon, and now they're able to lose weight.
Absolutely.
I mean, is that the way it works?
That's the way it works. I mean, and it works time and time and time again. So it's not just one patient this works on. It works on everybody. I mean, you mentioned that probably 90% of every patient gets this test done. Because I think it's really valid. I think it's really necessary in order to get them to be as healthy as they can possibly be. And the ALCAT test looks at many different foods. So you can actually customize it to what the person eats. Now, I have a list. I mean, the list I use is 150 of the most common foods that I would put people on. That would be on the Hamptons diet. So those are the foods I look at. But if you came to me and said, oh, I'm a vegetarian, or I only eat green beans every day of my life, you know, we would do different tests, and you can do that. So you can absolutely customize an ALCAT test for how you live and eat.
A lot of bad press about gluten, for example. Is that always showing up as something people shouldn't have?
Gluten doesn't always show up. But in my population, the patient population I see, pretty much 98% of the time it will show up. Gluten, casein, those are the big ones.
Is that dairy? Casein's in dairy?
Casein is dairy, right. And I think that's because I have a very self-selected group of people that come to see me. I mean, they come to see me because they've read my books. They know that my philosophy is more of a Mediterranean style approach. So it's lean proteins and fruits and vegetables and whole grains and things like that. So they're going to come to me thinking that they have those problems, thinking that they have problems with wheat, or if they have problems with grains, whatever. And the ALCAT test will pick it up, and it's remarkable.
So 100 different things it's looking at.
Well, it looks at a lot more.
Like food additives?
It can look at food additives, it can look at food colorings, it can look at preservatives, it can look at everything. You can literally, molds, I mean, anything you want it to look at, I mean, there's pretty much a panel for.
With the patient that comes to you for weight loss, take me through the process. Aside from the diet, what you're telling them to put in their mouth, take me through the ALCAT process. At what point do you say, okay, we need to take this test?
Well, they get the ALCAT test on day one. I mean, they come into my office, they'll be seen, they'll have a history, physical exam, just like any other doctor does. Then they get blood tests. Of course, I run blood tests that most conventional medical doctors would never run because they don't even know that they exist. And then I would do an ALCAT test on almost, like I say, about 90% of my patients.
Are they resistant at first? I mean, when I first heard about this, I'm saying, I don't have a food allergy. I've been tested.
Some of them will say, I don't have it, I don't want it, don't even do it. But once I can convince them, and it doesn't take that much convincing. I mean, you have to realize when they're coming to see a nutritionist, they know I'm going to look at food. They know I'm going to look at the foods that they're eating. So they want that test. A lot of people come to me out of referrals because their friend had gotten the ALCAT test and had gotten such great results. Their mother had the ALCAT test, so they want it. So they come in, get the test, right done on the first day. Get the results back maybe a week, 10 days later. And it's a simple blood test. I mean, it's just like, just get your needle in your arm and that's it. Very simple. Get sent off to the lab. And then 10 days later, get the results back. And lo and behold, you'll be able to know what your hidden food
format?
sensitivities
What
are.
format does it come in?
It actually comes in a multicolored format, so it'll
Okay.
tell you what you're most sensitive to, then the second most, and then the, I hate to call it least, but
Okay.
minimal, let's say. So it comes in yellow, orange, and red. And then it also then gives you the foods that were tested that your body did okay with.
Okay.
Then it actually gives you a list of the where those foods can be found, because a lot of people don't realize that soy can be in edamame, soy sauce, soy milk, soy protein isolates, protein shakes, those types of things. So it actually will list where all the different foods are, list the different families of foods. And then what you'll also get is a rotation diet. So they actually give you a way of kind of still having the foods in there, but not really. You know,
So at first you eliminate the ones that your body reacts to the most, that you are the most sensitive to?
Well, in the way I use the test.
Okay.
I mean, and I'm sure every doctor that uses the ALCAT test will use it differently. But the way I use the ALCAT test is I will eliminate the most positive, so the ones that are in orange, I mean the ones that are in red, and then the ones that are in orange. So I will eliminate, I don't mind so much the yellow ones, unless they have a really long list.
Okay.
If a patient has a huge list of foods that they're sensitive to, then you know there's an underlying gut issue. You know
Okay.
they have an underlying digestive problem, and you've got to eliminate everything.
Okay.
So this food sensitivity, and again we're getting back to the difference between food sensitivities and food allergies. A food allergy, a true food allergy, you'll never be able to eat that food again.
Okay.
A food sensitivity, you'll be able to get it back into your diet at some point, but you've got to heal the inflammation that these foods are causing, or you'll never be able to lose weight.
So what are the common foods then that can sabotage health or make somebody fat?
Common
you
foods. Well, sugar I think is the big one.
Okay.
You've got things like sweeteners, like aspartame, NutraSweet, those things. They also can keep weight on, even though people say they're diet and they're non-nutritive and they're non-caloric and that sort of thing. But your body doesn't.
Do these always come up? These
On the-
artificial sweeteners on the test that
If
you're-
you test for them, they will often come up because most
Okay.
people who diet tend to use foods that have those types
Okay.
of products in them. I think wheat is a very big one. Dairy is a very big one. Gluten is huge right now. So many people have gluten intolerances.
Are people surprised, by the way? They get the test back and they say, I can't believe this. I eat this all the time.
Yes, absolutely. People are sometimes shocked when they get the test results back and then they don't believe it because they say, well, these are the foods I eat every day.
Okay.
And then you have to explain to them, well, think about it. I mean, the foods that you're putting in your body, the most often, the foods that you're exposed to every day, the foods your body's building up an antibody response to, of course they're the ones that you're going to be the most sensitive to. So the ALCAT picks that up as well. They
Now,
also
help me
pick up
understand-
things that people have never eaten before either.
Like?
Well, you know, so whatever, a miscellaneous food. Some people will say, well, I've never eaten a pineapple.
Right.
And it's on there. Why?
Okay.
You know, so there's always lots of different questions.
So when the ALCAT test picks up a sensitivity, what's going on in the body that's so negative or causing this inflammatory response or releasing antibodies? Help me understand that process.
Well, what happens is when you eat a food,
Okay.
it's got to get digested. So as it goes and then passes through the digestive tract, and what happens is there are microscopic little holes that happen in the digestive tract.
Okay.
And so these microscopic little undigested food particles get caught in your bloodstream. Then your body says, wait a minute, this isn't supposed to be here. This is a foreign body, it's a foreign invader.
So it treats it like a
Whoa.
foreign invader?
Absolutely. It treats it like it would a flu virus or a cold virus or any other bug that we get. And it
Okay.
says,
Interesting.
whoa, this should not be here. So it sets up this whole cascade of immune response, immune system things, and that's why you get the inflammation. I mean, you have to realize most of our whole immune system cells reside in our digestive tract. 60 to 80% of our cells, of our immune system cells, reside and/or are made in our digestive tracts. So when that's not functioning properly,
Okay.
so many things can go wrong. So many things can go wrong. I mean, you could name it, and it can go wrong. Migraine headaches, indigestion, weight gain, inability to lose weight, headaches, regular old plain old headaches, allergies. eczema,
Really?
arthritis.
So with headaches, how could a food sensitivity have anything to do with a headache?
Well, what generally happens, somebody will get the ALCAT test, they'll eliminate all of the foods. Then they'll come back a couple weeks, 3 weeks later, and they'll say, you know what, I've been having these headaches for years, on and off, and I haven't had them anymore.
Okay.
And then they get a little incredulous, and they're like, well, could it be this ALCAT test? Could it be this elimination diet you've put me on?
Right.
I'm not sure. But the real key is when they go and they eat that food, and then they get a response again. They get that headache comes
Interesting.
back, that indigestion comes back.
And they never made the
that
connection.
Arthritis pain comes back. They never made the connection. People don't make the connection with food ever. How many people do you know actually either A, watch what they eat, or B, even notice any reaction from what goes into their mouth to what comes out?
What about fatigue, though? It says that with this test helps you treat people that experience fatigue on a daily basis.
Absolutely.
How so?
Because, again, anytime you eliminate something that's an offender in your body, something that your body doesn't like, you're going to have more energy. Because guess what? Your body is now eating nutrition, getting the nutrients from foods that your body responds well to, as opposed to foods your body doesn't respond well to. So it decreases inflammation across the board. So it's just like if you get enough sleep, you feel better than it. You feel great the next day, right?
Okay.
Or if you've had only 3 hours of sleep the night before, you're a little groggy, can't get through the day maybe so well. It's the same with what you're doing to your body. I always call it the internal environment. Keeping the internal environment clean. If we can keep our internal environment clean, then a lot of the offenders, a lot of the external offenders, like having a bad day, like our bosses, like a traffic jam, something like that, things that make us so cranky and irritable and tired and fatigued all the time. If we can eliminate the internal stressors, the external stressors aren't that bad.
What about those people that say, you know, doctor, I have a slow metabolism? Do you find that when you remove these foods that are causing these problems, that all of a sudden their metabolism is not what they thought it was?
Well, slow metabolism takes on many forms.
Okay.
And one could be a thyroid problem. So if you do the ALCAT test, eliminate some of the offending foods again, you will get your body's thyroid can actually start working better. So it could be
without medication.
Absolutely without medication, without even iodine, without kelp, without any help of any sort.
Okay.
It's just another way of, like I said at the beginning, it could affect your body one way, it'll affect my body a different way. Some people's metabolisms will get affected. Some people's thyroid glands will be affected. Some people, the way they digest the food, their bowel movements, irritable bowel syndrome, that's one of my favorite things.
Okay.
This doesn't exist.
Really?
Just take an ALCAT test.
And eliminate those foods.
Eliminate those foods, you'll never have irritable bowel syndrome again. I mean, it's just the biggest joke to me is IBS. So that's just ridiculous. So everybody's sort of body is different. And I think that's what makes a test like the ALCAT so important.
This sounds simple. Why isn't every doctor doing this?
I think every doctor isn't doing it because A, they don't know about it. I think if they knew about it, like I did, I think they wouldn't hesitate to offer the test to their patients.
So who's an ideal candidate for an ALCAT test? I mean, who should get this test?
I think everyone should get an ALCAT test. Everyone in America needs an ALCAT test. But if you're suffering from inability to lose weight, if you've got fatigue, if you've got hair problems, I mean, if you've got indigestion, if you've got arthritis, if you've got any inflammatory condition whatsoever, including obesity, diabetes, heart disease, anything, you need to get an ALCAT test. I mean, there's no reason why you should have any level of inflammation going on in your body. Eczema, allergies, psoriasis,
these go away.
Asthma. Absolutely. Everybody who suffers from any one of those things needs this test. So doesn't it sound like most people you know?
Right, yeah. So you just take the test, eliminate the foods that show up, and then 3 months later you're allowed to bring them back in?
Depends.
When?
I mean, it really depends on when you bring them back in. It could be 3 months, it could be 6 months, it could be 9 months. It always depends on how well the patient follows instructions.
Okay.
So if they follow instructions really well, 3 months is usually enough.
Okay.
If they don't, it takes longer.
Okay, so food sensitivity, we're going to take a quick break. So food sensitivities could make you fat.
food sensitivities can absolutely make you fat.
Okay, we're going to take a quick break, and when we come back, more about the process, what somebody could expect, and the science behind ALCAT. You're watching The Wellness Hour, the leader in medical news and information. We'll be right back. You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Fred Pescatore, the author of The Hamptons Diet. We're talking about how food allergies, hidden food allergies, can make you fat. For people just tuning in, again, there's a difference between a hidden food sensitivity or allergy and one that's not hidden. Tell me the difference again.
Well, the main difference is that food allergies you generally know about.
Okay.
I mean, whether it's to milk or eggs or wheat or whatever the biggies are, you know it. Mm-hmm. You're going to get hives, your throat's going to close, you could die from it. Hidden food sensitivities, which are something like the ALCAT test will uncover for you, are things that you may not know you have. Mm-hmm. Or chances are you don't know you have. And that's why it's so important to have a test like that, because then it helps me as a physician fine-tune your diet. If you're coming to see me for nutrition, I need to know what to tell you to eat and what not to eat. I mean, there's 5 billion people on the planet. We can't all be on the same diet. We can all be on the same page, but it's got to be individualized for you and for me and for everybody else out there.
So how effective could you be without the ALCAT in this weight loss process?
With weight loss? I think you can be effective without having to use an ALCAT test to lose weight. But I think you're not going to be as effective.
Okay.
Your weight loss might be slower. It won't be as perfect for you. You might hit plateaus more often. You might get irritable. You might get those mood swings, the highs and lows that people get during dieting, the depression that people get during dieting. A lot of those things aren't there when you do a test like an ALCAT test and find your food sensitivities.
How long have you been using the test?
I've been using the ALCAT test maybe 10 years now.
Okay, anything surprised you when you first started doing this with patients?
The thing that most surprised me about the ALCAT test was how accurate it was. How it was able to pick up things that people had and they didn't know about it. Now, some people will say, oh, I knew I had a sensitivity to broccoli.
Is that right?
I knew I had a sensitivity to garlic. And they know it. Other people will say, what, are you kidding me? I eat this stuff every day.
Okay.
Nothing happens to me. I eat it every day. And I say to them, well, you know, you're 50 pounds overweight. Maybe if you didn't eat it every day.
So there are some vegetables that show up that when you eliminate them, they feel better?
Of course. Fruits, vegetables. I mean, these are all foods. I mean, we can't eliminate any food.
Is it genetic? I mean, is that how somebody has a food sensitivity? Are they born with it?
I don't think, no. People are born with food allergies.
Okay.
They're not born with food sensitivities generally.
Okay.
Food sensitivities are really, I think, environmentally based.
You develop them?
You develop them because of how you eat, what you come in contact with, either how bad or how well you eat. It depends. Really all depends. I think it's an environmental situation.
Okay. What frustrates you, by the way, in the world? I mean, you've written a best-selling book, New York Times best-selling book. What frustrates you about diet books that are on the shelves? Some of them.
I guess my biggest problem with diet books on the shelves is that most of them have a gimmick.
Okay.
Most of them tell you, do this, do that, you know, stand on your head, twist during the full moon, you know, do whatever it takes. I don't really believe in something like that. And the Hamptons diet for me, or my book, is really just about getting back to nature, eating what nature intended us to eat, so real foods. So lean proteins, vegetables, whole grains, legumes, nuts, seeds, healthy fats, that sort of thing. And the ALCAT test helps me figure out exactly what that person should be eating.
Okay.
So that's why that food intolerance is so important.
But even reading your book, it seems easier said than done. We all know that we should be eating that way, but we can't do it. How does ALCAT, and in my notes, they make a bold statement in their book saying that when you remove these food sensitivities, that your appetite goes away, or your cravings for these bad things goes away. How can that be?
Well, cravings do go away. I mean, when you get your diet under control, cravings go away. Physical cravings, physiologic cravings go away after 72 hours. Psychological cravings,
you mean after removing the food?
Never go away. Absolutely.
Okay, so something comes up on the ALCAT test, and you're saying, okay, broccoli is one of yours, maybe cheese or dairy. You remove it, and all of a sudden they have self-control for the first time in their life. You've seen that.
I've seen it time and time again. And it's self-control definitely over those foods. Because the other thing the ALCAT test does is it's a nice psychological tool for people who are trying to lose weight. Because it gives them a roadmap. So it tells them, it kind of guides them through a nice little path, so to speak, that they can go down. This is for me. So therefore, I'm going to be really motivated. I'm going to really follow
Gives them leverage?
I'm going to really do it. Absolutely. I mean, it empowers them.
It seems easy. I mean, you just don't eat what shows up on your test.
Correct.
As sensitive.
That's correct. That's how the ALCAT test works.
And the weight falls off, in some cases.
In a lot of cases, the weight just falls off.
Help me understand about the cravings, by the way. I'll let you finish your thought there first.
But, well, I can work cravings into that same thing. You have to have an underlying healthy diet.
Okay.
So the ALCAT test is you're not going to get the ALCAT test and it's going to say you can eat ice cream and cake and candy and cookies and all that stuff. Okay, so don't expect that to happen. So you've got to go from working from an underlying base of something that's healthy for you. Mm-hmm. And therefore, when you have that base already, and then you do the next step, which is to really fine-tune it for yourself by getting something like an ALCAT test, then you could say, is it the pickles I'm eating? Is it the cucumbers? Is it whatever really odd little food it may be that will get you out of bed in the morning without a headache, without needing that cup of coffee, will not make your stomach growl, will not give you that 3 o'clock, I need to take a nap, or I need to go to the candy machine right now. You'll get none of those things. Your headaches can go away. Your arthritis can go away. Your diabetes can get helped. All because your body is starting to process the foods it was meant to process.
Are there those patients that are afraid of the test? They're saying, I don't want to hear of all these things that I probably can't eat?
I've never had one person be afraid of the test.
Okay.
Except maybe a child who doesn't want to get their blood taken.
Is this for children?
Absolutely.
At what age?
I would say 30% of my practice is pediatrics, and every one of them will get this test done. And it's different. I mean, I like to do it starting from after they finish nursing, then at 2, then at 3, then at 6.
So when you eliminate these foods, because we talked earlier and you said you could bring them back in, does the body heal itself from these food allergies or
Absolutely.
sensitivities?
Yeah, no. The body won't heal itself from food allergies, but from food sensitivities, it absolutely can heal itself from that.
Now, another way to put it is intolerances. So your body, and help me understand this, is not, it's an intolerance? Is it a food sensitivity? I mean, again, what is it? What is the test picking up?
Wow, those words are really the same thing.
Okay.
I mean, it's something your body is
You have a bad reaction to it?
Yeah, you have a sensitivity.
Okay.
So it's just like, I don't know, if you put perfume on, or if you rub against newsprint or something, people have sensitivities to that. Or an intolerance to newsprint or something like that. It's the same word. It's all semantics.
Okay.
But the end result is the same. The end result is you're going to get better if you have an ALCAT test because you're going to eliminate the inflammation in your body. When you eliminate inflammation in your body, everything gets easier, better, and you feel better.
So this has to be combined with a great diet?
I think the ALCAT test has to be combined with a really great diet like the Hamptons diet.
Okay. Physicians watch this program. What do you want them to know about this ALCAT test?
I think what I want physicians to really get from an ALCAT test is that they use the argument that it's not 100% sensitive. No allergy test is, and that's what they need to understand.
Okay.
No allergy test is, no food sensitivity test, none of them is 100% accurate. So you've got to find a way to work it into your practice to figure out what works best for you and not to be afraid of it, because the statistics are just as good for an ALCAT test as they are for any scratch test, any skin prick test, any of that other stuff that they do, because it's not very good for that either.
So once they use it, you think they'll always use it? Any medical doctor that starts using it?
I think any doctor that uses it, any doctor who cares about nutrition, any doctor who cares about seeing their patients get well, once they start using the ALCAT test, will use it forever.
Now, in my notes, and we've talked that off camera, that a food sensitivity could make you feel sick.
Right.
How so?
Well, let me give you a really easy example. You know when you get a flu or a cold or something?
Right.
And it's this invader, and it goes around, and your immune system has to try to really work hard to get rid of it, and that's why you have fever and aches and chills and fatigue and all of that.
Right.
Same thing happens when you have a food intolerance, because your body is building up that same sort of response to a foreign invader. So something the ALCAT is testing for foods that are foreign invaders in our bodies.
It identifies them.
Correct. So when you eliminate them, you're not going to get the fatigue, the chills, the fevers, the ague, whatever you want to call it.
So many people that have these, they live in a life of flu-like symptoms, tired all the time.
All the time.
Achy.
Absolutely.
Those
People
things
think they have to live like that.
Really?
I mean, that's the funniest thing to me.
Isn't that simple, though?
It's very simple.
When you hear these things, and you're a medical doctor, do you feel like just, and you're at a party, and they're talking about these things, do you feel like, hey, you just have to get the right test?
Well, when I'm at a party, I don't tell people I'm a doctor.
Right. I mean, but does it go
way.
on in your head where you think, I wish I could tell them about this test?
Well, actually, sure. I mean, I wish everybody knew about the ALCAT test, because it is so simple. I mean, it's so simple to eliminate an offender. If something's bothering you, would you use a laundry detergent that made you break out every day?
No.
Of course not. So why would you eat a food that would make something in your body happen every day? Whether it's headache, whether it's fatigue, whether it's upset stomach, whether it's gas, whether it's acid reflux, what have you. Why wouldn't you do the same thing? And we have a tool to identify that.
So these metabolic problems, slow metabolism, fast metabolism, but for these people that are having a tough time losing weight, would you say that 90% of the time they definitely have foods that are interfering with their digestion, with their fat metabolism?
I would say more than 90% of the time, if someone's having difficulty losing weight on a plateau, they need to investigate an ALCAT test, because they need to look at what their intolerances are, what their sensitivities are, what are they eating that their body isn't burning correctly, isn't using as fuel, isn't making it work right. You want this to work right. You want your body, our bodies are a very tuned machinery.
Okay.
And when we put something in there that doesn't work, I mean, it's like I always tell people, would you put leaded gasoline in your car?
No.
Absolutely not. So why would you put something that you have an intolerance to, a food sensitivity to, in your body? It's not going to make it work right. And unless you have a test like the ALCAT, you're never going to know it exists.
So give me some symptoms that you hear as a medical doctor that says, okay, this person has a food sensitivity that is causing them.
Well, I don't want to sound like an alarmist, but I could probably list 40 or 50 different symptoms. Okay. Anything starting from fatigue, to asthma, to allergies, to eczema, to psoriasis, to hives, to inability to lose weight, to gastric reflux disease, to irritable bowel syndrome, bloating, gas, constipation, diarrhea.
All of these things.
Runny nose, itchy eyes, all of these things. Hair loss.
All connected to a food allergy or sensitivity.
These can all be connected to food sensitivities, absolutely. Doesn't mean they are, but they can be. And you've got, from a physician's point of view, you've got to uncover everything you can possibly uncover.
Okay, now tests like the ALCAT, you think it'll become the gold standard someday, where it'll just be part of every medical practice checkup where they look for these things?
I would hope that one day the ALCAT test would become a part of most physicians' protocols for treating patients.
Now we're going to bring Roger Deutsch on the program. He is the co-developer of the ALCAT test. He's a science guy from talking to him. Why did you choose ALCAT? And how accurate do you think it is, in your view?
Well, there are many food sensitivity tests out there on the market. And I chose ALCAT because I thought it was the most sensitive and the most specific, meaning it gave me the better results.
Okay.
So, and also, having used it now for over 10 years, I actually know its quirks, and it's easy to figure out just exactly what is right and how it all works and how to put it together for someone. So I think it's the gold standard test out there for food sensitivities. So that's why I've chosen it.
Roger, welcome to the program.
Thank you. Nice to be here, Randy.
Now, Roger, you're the co-developer of the ALCAT test. And what is your role with ALCAT?
Well, my official role is a senior consultant to the company.
Okay.
I founded the company that developed the test a little over 20 years ago.
What is the hardest thing for you to explain to, I guess, practitioners about the ALCAT? I guess there's confusion about a food sensitivity test and a true food allergy test. What is the difference?
Well, allergy and sensitivity are quite different. Allergy is our body's evolutionarily developed response to a parasitic infection.
Okay.
And parasites, by their nature, require a much more aggressive response from the immune system, a very dramatic response. And when it's directed against food, although it's very rare, but we do hear of these cases where a person has a true food allergy, the results are very dramatic, and therefore it's very obvious that a person has a reaction to that food. Intolerance or sensitivity is actually biologically quite different without going much into the detail.
Okay.
It's subtler. It's involving a different branch of the immune system. The symptoms are not as dramatic, and they may be delayed by even a few days.
Now, Dr. Pescatori says 72 hours later, you may eat something and then get a response, and you don't connect the two. You don't.
That's exactly right. And that's why we sometimes call these reactions hidden food allergies, because they're obscured. You don't know you're having a reaction to
Now,
that
how
food.
are you testing these in the laboratory? You work in and around the laboratory? Is that right?
Yes.
Now, how are you doing it? It's 100 foods, and how are you mixing with the blood? I mean, what's going on?
Well, it can be a greater number of foods than that, or other substances. Could be 200 foods, for example, plus
Okay.
food additives and so forth. What we